Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming the future of health. I'm Logan Plaster. My guest today is Margaret Melville, the CEO and co-founder of Lasa Health. Margaret, great to see you.
Great to be here. Thank you so much.
So you have come to market with a new way to predict endometriosis. Is that correct?
Yeah, we actually focus on not just endometriosis, but chronic pelvic pain.
Okay.
Endometriosis is one of the most common causes, but it can often be confused with other conditions that cause pain in a similar area, like urinary conditions, GI conditions, and other gynecological conditions.
Why is that such a murky area of women's health? Why is it so challenging?
It's because of that, because it's so complex and it doesn't lie clearly into one specialty. So oftentimes you'll see patients that get bounced around between different specialists who aren't sure what it is. So allergists and OBGYNs and GIs, and no one's quite sure what the cause is.
I understand this comes from a personal journey that you went through. So you've experienced what you are trying to solve for other people.
Yeah, exactly. I went to over 25 doctors looking for help and was constantly in and out of the ER with severe pain, not knowing what was wrong with me, and found the system just wasn't set up to help patients with this type of pain. And it's common. It impacts 25% of women. So It's not talked about enough for how common it really is.
Well, a lot of women go through this sort of challenge. Not all of them start AI companies to try to solve the problem. So what was it about your experience and kind of what you brought to the table that sets you up for this?
Yeah, I was actually already wanting to start a company.
Okay.
So my first company was a medical device startup, and I then worked for USAID for a few years in their global health innovation team. And working in this innovation space really got me excited again about AI and about the possibility that has to really improve the affordability and the accessibility of care. And so going into my MBA program, I said, okay, I'm going to start a AI health tech company, but what condition or what area should I focus on? And it was then that all of my health problems kind of accumulated, and I decided, this is the area where I want to focus.
You mentioned at first the complexity piece. It's a multifactorial issue, so we need technology to help us there. But then you just mentioned accessibility. So talk to me about the availability of providers and specialists.
Oh, there's such a shortage. There's not enough providers who really understand these conditions, and not enough training in medical school for these conditions as well. And so you have some providers who've really become champions in becoming expert in endometriosis and adenomyosis and other related conditions, but there's not enough. And so many patients have to wait years to see one of these really great specialists, or fly across the country, or pay out of pocket for their surgery, pay $10,000, $20,000, $30,000 out of pocket to get this life-changing surgery.
I've heard stories of primary care physicians who just were very anxious about a woman who had chronic pelvic pain because they just didn't know how to help them. It becomes this like sort of black box area.
Yeah.
So even for the provider, they don't have the tools that they need, right?
They don't. And providers, they want to see their patients get better. And with chronic pelvic pain, there isn't a pill or one thing you can do that the patient will get better. It takes a really long time to figure out what combination of treatments work well for the patient.
Okay.
And even then, it's usually not 100% better. It's about being able to manage the symptoms and improve the quality of life. So it's frustrating for a provider to have their patients coming back again and again, not getting better and often getting worse.
Okay, well, it's a good segue into exactly what Lasa Health is. What's my experience if I'm one of your patients? I've got chronic pelvic pain. Where does it start?
Yeah, so we're an end-to-end patient engagement platform, really streamlining from the very beginning of when the patient's getting diagnosed and you're trying to figure out which cause of chronic pelvic pain it is. And to whatever surgeries, treatments, we really focus on shared decision-making and empowering the patient with information so that they can make informed decisions about their treatment options.
Okay.
To ongoing patient monitoring, so we can see, is the treatment plan working? Does it need to be updated? And staying with the patient through their full journey.
So am I filling out a patient profile? Am I doing sort of surveying? Is there like a telemedicine component to it?
Yeah, so we don't provide telemedicine. We partner with existing healthcare providers. So we'll layer on top of a clinic or a health system. And you interact with us through our mobile app on the patient side. And on the provider side, it's integrated into their clinical workflow. Okay. So for the patients, the app's very engaging and gamified. The interface is with an AI chatbot. Okay. And so when you're it's very different than filling out like check the symptoms you have.
Yeah.
It's about telling your story and really having this engaging conversation with a chatbot who cares about what you're experiencing and creates a safe space for you to share information about conditions and symptoms that are often stigmatized and uncomfortable to talk about.
Tell me more about that. How is the chat more engaging, more natural?
I mean, even things as simple as acknowledging the fact that we're asking patients questions about things that are really traumatic to them, about years of suffering and pain, and to me that requires a response, having the chatbot come back and say, I'm so sorry you've been experiencing that. That sounds so hard. We're here for you. We're going to help you get through that. It's
so building
something
empathy
so simple can really change
into the process.
Exactly.
Got it.
Yeah.
Okay. Well, let's talk about sort of market response. When did you launch the company?
We started the company in 2022.
2022, okay. And how has the market responded? Do you have any traction to date?
Yeah, I think when we first started it, not a lot of people were talking about chronic pelvic pain and endometriosis, but that's completely changed. I think it's on top of everybody's minds. They're really seeing that this is the next frontier of chronic conditions. That
Why
this
is
is a
that?
huge issue.
Why is that?
It's been a combination of a couple things. There's been a lot of lobbying efforts. There was a new documentary called Below the Belt that was released and shown to a lot of senators. So there's been a lot of efforts from nonprofits, from advocates to really create this movement and raise awareness about this condition. You see celebrities as well sharing their stories of their surgeries, of their experience not being diagnosed for years, and kind of together as a community fighting the stigma around the condition.
Sounds like the timing is right.
Yeah, definitely.
Talk to me about, early partners, kind of how is it going actually with traction?
Yeah, definitely. We had so many great partners supporting us, helping us develop this pathway, reviewing our content, and we just launched in our first clinical site. So we're now going live with a surgical center. They have locations in DC and Miami. And so this will be every single patient that comes to have surgery at that center will be onboarded onto our platform and engaged and monitored by our platform for a year after their surgery.
Nice. And I heard that you got a SBIR grant.
Yes.
Tell me about that.
Yep, so we got an SBIR grant from the National Science Foundation, and that was focused around flare-up management. So a flare-up is when a chronic condition symptoms become aggravated, and oftentimes those are the moments when a patient will visit the emergency room. So what we're working on is helping the patient self-manage when they would have gone to the emergency room. And this was inspired by my own 3 experiences at the emergency room where I was in so much pain and wondering if I was dying and go to the ER, and all they did was run some tests, found out I wasn't dying, which is great, sent me home with ibuprofen. And it's a frustrating experience for a patient when you're so sick and trying to figure out what's wrong and to just get prescribed something you already have at home. And it's because the emergency room is not the place to go for chronic pain. So the patients need more tools to self-manage from home.
So what did the SBIR grant enable you to do?
So it provided us the funding to build out our chatbot specifically around this and test it out. So the first phase is $275,000 to build the initial version, and then the second phase is $1 million that we'll use to then test it and actually run some studies to show if it actually in a clinical setting will reduce the ER admissions.
Yeah. Are you finding that the sort of fervor around conversational AI is helping your process of kind of pitching this to people?
Definitely. Yeah, we're seeing the power of these technologies. And when we first submitted our SBIR grant, it was a week before GPT launched their platform. It was last October.
Wow.
And so now everything's completely different, and we're able to use the newest technology for chatbots to make our product 10 times better than it would have been if we had built it a year ago.
Interesting.
So the timing has really been so perfect for us.
So that chatbot can be more natural, And now anyone with chronic pelvic pain has a reference point for a conversational AI experience. So now you can layer it onto this and say, you tried it over here just for fun on ChatGPT, right? Now you can actually use it to live a healthier life.
Yeah. And I think we're also looking at a chatbot, what you see with GPT is you have to ask the right questions in order to get the right information, which it's a struggle for a lot of people who don't know how to engage with chatbots correctly. And so what our team is really focused on is prompt engineering to turn it into more of a health coach, so that the chatbot is asking you questions and engaging you in a way that you don't see with GPT. And that really makes it a more user-friendly experience, so that any patient can open it and start engaging with it and find value from it.
That's an interesting twist on it. That's interesting. Margaret, well, I appreciate you taking the time with me. It's been really great to watch Lasa Health grow, and this SBIR grant and the new contract are going to help you propel into 2024. So we'll be watching you closely.
All right. Thank you so much.
All right.
Thanks for having
your time,
me.
Margaret.